Hello, I'm Kerwin Gaines, and welcome back to The Agenda. This is another season with new events, new issues, and we're going to ensure that you maintain your knowledge of the agenda right here in Delaware. And we have another repeat guest this season, another repeat guest. Thank you very much. Our Lieutenant Governor, Bethany Hall-Long, welcome to The Agenda.
Thank you so much. It's always a pleasure, Kerwin, to be with you and The Agenda and to have a great conversation where we can share important information with the community.
And let me tell you something. You are not just a traditional politician, right? You make sure that the truth is out there, difficult topics, yes. And we'd like to thank you for that and ensuring that Delawareans maintain their place on the agenda. Great. Thank you.
Thank you. Thank you for having me, and you're spot on. I think some of that comes from being a professor and a nurse, working every day, whether on the streets here in Wilmington or across the state, to really listen and bring resources to the community.
And you have done that, and one of the major things in which you have done that has been, unfortunately, on the opioid crisis right here, not only in the United States, but in Delaware. We may be the second smallest state in the union, but our crisis hits home just as much as it does in any other state in the country.
Absolutely, and as you know, the last time I was with you, we were wearing masks, during what we call the twindemic. We had the pandemic of COVID, and we've continued to have the opioid epidemic and crisis, which has been so incredibly real. Since I took office approximately 6 years now ago, we really put our shoulder in and have tried working collaboratively with community and other leaders to really resolve and come to solutions with mental health, substance use. And we unfortunately, every day, touches my heart. I get a call from a family member, a parent, a child, an aunt, or an uncle who tragically has lost a loved one to the crisis. And our goal through the agenda and others is to get the word out and to share what things we've been doing in the state to really tackle and to help set a model actually for the nation. I've led the National Lieutenant Governors Association, and a lot of eyes have turned to Delaware. And recently, in collaboration with the Attorney General's office, we've worked hard with them. They obviously went to task with the opioid settlement, and we're really pleased. That's going to bring another resource into our toolkit. Tell us
a little bit more. A lot of people don't understand the importance of this opioid settlement, right? And what it can do, and the statement that it made to companies that were supporting this epidemic.
Absolutely. And when we talk about opioid, you're talking about things like Percocet and Oxycontin, but then we've turned to what I call the bad one, which is fentanyl. And we know persons sometimes found their way with prescriptions, an injury, a back pain, or let's face it, sometimes people are embarrassed and afraid to say they don't feel well, they're not feeling okay, it's a stigma. And what happened, they would turn to illicit substances. And we have seen that whether through heroin, which is obviously injected or snorted in different ways, and this terrible fentanyl, people have gotten addicted. And what we've seen in America was during the 2000 period of time, I can say this as a nurse, we would always ask persons, how are you feeling today? And really try to alleviate pain.
What's your pain scale?
Right, what is your pain scale? And so what we've ended up having was the opportunity to see, unfortunately, Big Pharma, and I'm not gonna list all the companies, but there's many we know, whether it's Johnson & Johnson, Purdue, and others. We ended up having to, across America, attorney generals do class action lawsuits. And our attorney general and her office and others went to suit. We did win the opioid settlement. And prior to that opioid settlement, we've had in place certainly our behavioral health consortium, our overdose system of care, and other opportunities in the state where we're working with people in the community, our faith leaders, our hospital leaders, nurses, doctors, parents, and loved ones to really try to save lives and to lower the number of deaths surrounding opioids. And the goal of the opioid settlement is to be able to really do prevention, treatment, and to address things that everybody needs each and every day, which we can talk about a little bit more here in a minute.
Right.
But it's a big settlement. It's around $110 million over the next 17 years. It's going to come into the state of Delaware.
So how, and it may be too early. Tell me if it's going to be too early, but how is those dollars that have been allocated for residents of the state of Delaware actually funneling down to the people in need?
Well, they're going to funnel down, and I hope as the listening audience is tuning in, and many of you see me on this show through the years, where we talk about harm reduction. Some of you see me with the opioid kits, with the sprays, with Narcan. we're going to continue to do expansion in those areas of what we call harm reduction. And we're going to be working with you in the listening audience, our teachers, our schools, our faith leaders, to work on prevention and education measures. And we're really going to work hard to make sure that when somebody needs help, they get the help that they actually need. And we've done some of those things. I mean, we've talked about our Bridge program in the past. We've talked about our programs where people respond. But really, I know, Kermit, when we think about this, it really is all those support factors that families need. The opioid settlement funds will have a process where individuals can apply in the community. And right now, the commission that is comprised of around 15 members are beginning to listen. We'll have application processes available. And we really hope that communities up and down Delaware apply and that individuals speak up. And we've heard already, we've done some great listening tours this summer. And we had a lot of ideas shared. And they were things, that you and I know are important.
Yeah. And I know you don't have a lot of time with us today, but so I kind of want to get into some specific issues in regards to the opioid crisis. Now, we made it very clear that the pandemic was devastating, not only as a virus that was affecting many people, but it affected other services, right? There was, as you said before, there was 2 pandemics that were going on, basically. Yep. There was one that was dealing directly with the virus itself, and there was one still happening with the opioid crisis right here in our state.
Yep.
But there was, ripple effects to that. We've lost students that still haven't reconnected within our educational system, and that there's a lot of outreach doing that. But there were people that were going through crisis that weren't able to get help, right? But it's been through, organizations and people out there like yourself that are trying to bridge that gap. What's going on right now in the community?
A lot of different measures are happening, and that is what's really important. And it comes through community. It's not going out and telling the community what they need. It's really working through the community. And what we've been doing is, like you said, the schools. And let's step back a moment. During COVID, social isolation, people being at home, kids not having traditional learning. We've had an uptick by almost 25 to 40%, depending on the data sets, in suicide or suicide for ideation. And so we've worked really hard to get out information with our 988 phone number, which is in case you're feeling like you're going to harm yourself, for suicide prevention. We've worked hard with 211. And the opioid settlement, the goal of this is to really put structure in place with and through community to address what you just talked about. So our children in the school system, making sure that they have the resources so that they are not harmed. Right now, to parents listening in, on the street, there are some pretty bad things happening where people are lacing fentanyl into Adderall and other substances. And we've actually had cases here in one of our area hospitals where we had 2 teens who died because they bought on the street pills that they thought were Adderall or ADD med or Percocet, and they passed away because it was laced with fentanyl. It's a real issue. So again, whether it's the youth around social, emotional, what we call learning, and we've got to address the issues that affect the community. And we have this fancy term called social determinants. It's a big 2 words, but it really means the things you need to support yourself. And so the opioid settlement not only is going to do those traditional kind of treatment where a person can go and get a hospital care or outpatient service or get the Narcan prevention, but we actually also want to help people with housing needs, with transportation, and all those other factors, childcare, right? So it's hard to get treatment and help if you've got little ones and you don't have the support. So the opioid settlement is a really great tool to help address what I call a lot of the social injustices and equity issues in our communities as well, which is important to me as a nurse and as your lieutenant governor.
So, I see the opioid epidemic as an equity disparity in a lot of different communities. And what are we doing to, ensure that there's balance there?
That's a great question. And that's something that we've talked about. My office has been so honored to host Latino leader calls and Black leader calls and faith leader calls, not only during COVID, but since the pandemic has dwindled a little. But during the whole incredible opioid epidemic, a real focus has been on equity in Black and brown communities. Our Behavioral Health Consortium, which has been in play for around 5 years, where we've worked really hard to address the overdose death rate, has really focused on these special populations, in our African American community, our Latino community, and with our homeless as well as our military veterans. We've really put a real emphasis. And so the initiatives are important. And I would love to say to the viewing audience, be in touch, with us as we roll out the opioid settlement. I've got an incredible team in my office. We have great committees. They're open to the public. We really are working closely with people in the community who are trusted, and we work with community health workers. So again, that's how we get to the issues of making sure it's equitable so that, like you said, Black and brown communities are not left out. And the opioid epidemic is in every community. It's in every
gender. It's
every
just
gender,
not men,
and every level of socioeconomic status as well. But we have to have conversations just like we are today, where people know it is okay to not be okay, and it's okay to call and ask for help.
Yeah, it is. But another thing about being on the agenda, right? What legislatively are we doing in Dover, and heck, even in Washington, to ensure that we can put an end to this epidemic?
Right. Well, the opioid settlement came through Senate Bill 166, and it's never done in a vacuum. Our incredible members of the General Assembly, and I can't mention them all now because I'll probably forget one or two, and I don't want to leave anyone out. But I need the listening audience of the agenda to know you've got an incredible General Assembly who's been working really hard, and our congressional delegation as well, who have really championed making sure Delaware has mental health resources. We recently had the United States Secretary of Health here in collaboration with Nemours. We've been working with the Deputy Secretary of U.S. And Delaware is a role model. As I mentioned earlier, as chairperson of the NLGA and others in the past, people look to us. We're small, but we've put in place overdose systems of care and all. But to the viewing audience, that sounds great. That sounds kind of policy wonk. I need those listening in to know that here in Delaware, if you call and contact us, we have absolutely policies in place to support your families. No one's going to be turned away from treatment. We have a way to get individuals care when they need it, and that's why we've put in place mobile units. We also have expanded, thanks to leadership in the legislature, mental health services for our children. And also, we just recently had signed into law, thanks to leadership again in the House and Senate, where we are going to have screening, mental health screening, included with your annual health screening. So these are some really important steps. And in addition, you and I talked the last time on the Family Medical Leave Act that was sponsored. All of those things combined together really should, I hope, give a little sense of comfort to those listening in that Delaware is really trying to give you the support you need. But it doesn't do you and I any good if people don't access the support that we're putting in place or share with us their ideas and their stories. Because, in Delaware, the 500 and some individuals we lost to overdoses to opioids last year, they all had a story. They had a name. And, we want to continue to work to decrease our overdose deaths. And the only way to do it is collectively through community.
What are we doing at the school level, right, to educate our students to stop this early from happening?
Early is important. I see that chairing the Board of Pardons. One of my jobs is Lieutenant Governor, and I often see those who end up in our justice system, had trauma and had ACEs and had programs that didn't have the support. So we're working hard. I know the First Lady and others are on trauma prevention. And I know in our Behavioral Health Consortium and the opioid settlement, we really are going to be focused on getting the resources to our children, doing prevention, and really at the doorstep with the parents and families. It's tough. If you're a single mom, you've got 3 or 4 kids, you're working 2 jobs, you may not be as attuned to the change in your child's behavior. And again, acting out and not being themselves, not necessarily always being depressed or crying, but a sign for cry comes often in our youth, and parents sometimes miss that. And so that's why we've worked hard in the legislature to put in place, and through the governor's office and others, resources for mental health counseling, resources for wraparound in our schools. My office has been working with the Kennedy Forum, Patrick Kennedy, and Amy Kennedy, to make sure that our children, not only here in Delaware, but across this country, are getting those social emotional resources. The opioid settlement will be one of the tools to help fund, hopefully, some of those preventative measures.
Yeah, I hope it does too. I think that starting that foundation in early education is very important. And if those funds from the opioid settlement can go directly to that and broaden the scope of everything that's going on with the opioid crisis in our state, yep. I think it'll be very, very effective.
And that's the leadership, right? And that's why, as a leader in Delaware, I've been really pleased to step up and to really work on the street, at the street level with community leaders to make sure we have the funds, that we make sure that persons are going to have appropriate housing. It is hard to study. It is hard to not have emotional distress and trauma if you are living around gun violence, if you are living without food on the table, if you don't have the support. And that's why that fancy word of social determinants is so important. And as a leader in this state, it is critical that we address that. And the opioid settlement will help there. And also as we work on workforce and jobs. So we have jobs, we have to have mental health support, we have to have the strongest education system, and most importantly, having that healthcare access. So if you put those pillars together, kind of like the four legs on this stool, right? Workforce economics, healthcare, education, and access with equity, that's really important.
It's very important.
And I saw that during COVID.
Right.
When I was out on the streets working with our National Medical Association, the Black Docs Association, having resources and from people they trust. Trust is a really big, important part.
It's human infrastructure, just not the infrastructure that's on our roads, but going directly to the people and making us a stronger people. And what folks tend to forget is that our true strength as a country is in our people. And if we can make sure that they are healthier, stronger, and smarter, we will stand up better in this world of ours.
That sounds great. And it's about the unity, right? We're all human, we all bleed red, and we need to totally work collectively together. And the opioid settlement is one of those tools in the toolkit that will help us do exactly what you just said.
Yeah, hopefully so. And I think with you behind the wheel steering the ship, we're going to be just fine.
Let DART do the driving. DART First State provides transportation that is clean, safe, reliable, and affordable. Plan your trip and get real-time bus information with the free DART Transit app. Scan your phone to pay your fare with the free DART Pass app. So what are you waiting for? Try transit today. Visit dartfirststate.com or call 1-800-652-DART.
I want to talk about the election last night, right?
Oh, wow. The primaries.
The primaries, right. I'm discouraged about the voter turnout, right? And people, I won't get into here or there being on the agenda of who won and all these other things. We won't get into that. But I will say the importance of getting out to vote and knowing how important that is to you as a resident here in Delaware. What would you say to encourage people to get people out to vote?
What I would say, a non-presidential year, we usually have a pretty low turnout. 2014 was the worst ever. It was like 7%. I think last night, and again, I'm taping this without official numbers, it was maybe going to come in around 10%, maybe higher, by the time you and I leave this interview. People have to recognize that you're going to have the same and things aren't going to change unless you elect people who work through you in the community. So making sure you have individuals who represent you. We don't want to repeat the past failures. So to move from the past in the present to the future is electing persons who listen. And the only way that's going to happen is to go out and to vote. I am a wife. I know you worked with a military veteran. You recently worked down at Aberdeen. As a wife of a veteran and who spent time at the, National Arlington Cemetery, and it's disheartening when I know individuals don't think their vote matters.
Right.
Somebody laid their life down, and so I know that sounds a little intense, but I really know, and I've seen it, and I've borne witness to it, that if you get behind a candidate who stands up for what you believe in, go out and vote. It does make a difference. And in America right now, where we do not have equity, you still have structural racism in place. We have threats on across the board reproductive women's health rights. How do we get in these places? by being complacent and sitting back and not voting. And so I really hope that come November 8th this year, when your chance is there, that you vote. And if you can't get out to vote, Delaware, under the leadership of the General Assembly and the governor, we've put in place ways you can go vote early and by absentee. And so we hope that that number is much higher when I come back. Hopefully I'll be back and interview with you sometime
Absolutely.
later in the fall, and we can have a
right
high
now.
number. Thank you. We'll get that on the books.
So, I mean, we're talking about voting, right? And I want to be very clear that you still support legislation down in Dover as the lieutenant governor.
Absolutely. And I come up, we write legislation.
Right.
As a rep and senator, I know I went down and they labeled me as the most prolific legislator in getting bills produced. And I think part of that, as a nurse, I can bridge people. We can work together and come out with policies that I say are really bipartisan issues and nonpartisan solutions. Like, we have to have those solutions that make a difference and get rid of all the bickering.
Yes.
And that's what I'm about. So getting people out to vote, being at the table, helping to write legislation is so important. So get involved, get involved.
And so I tell this to most of the politicians that come on. I'm giving you my magic 8 ball, okay? You can predict the future. What legislation would you like to get passed during the next session?
I think in the future period, this coming year, that's really important that we continue. Since tonight we're talking today about the opioid and the mental health, focused in that lane, I'd like to continue to see breaking down some barriers around insurance. We passed the mental health parity bill, but I would really love to see us be able to expand on the mental health. I also would love to be able to see expansion on some of our workforce development initiatives. Also, I was really pleased with the Family Medical Leave Act that we recently supported. I have a list that is this long, and when we come back, I can go into legislation,
right,
agenda, policy for the future. But there are seriously some things we need to do in early ed, and there is a lot in healthcare. And I know for retirees and others, we're working hard to make sure that their healthcare is protected. And as far as the jobs and incentives for workforce coming into Delaware, there's some really key ideas and some key legislation.
I worry about the workforce here in Delaware, especially during our current inflation increase here. I have a fear that, I hope that wages increase along with the inflation to help balance it out here in the state for our citizens, as well as, ensuring that businesses are still coming to the state of Delaware to employ our folks. And is that happening? Are
Right.
we really pushing that here in the state of Delaware?
Yeah, we are. We've got to continue to do that. As chairperson of, again, as the NLGA and others, as I go across this nation, trust me, I'm very competitive about bringing business, working hard with our governors, the business partnership, our small business associations.
Bringing nurses here to the state of Delaware.
Absolutely, and the workforce
to deal
is
with our
critical.
healthcare shortages.
Critical, making sure too, while we're doing that we're also keeping the wages up. Saturday I was at a Coalition for Black Trade Union event, and we were talking, majority of the workforce, particularly during COVID, was African-American women, but they still make only 60 cents to $1 on what men do. And so it's really important, while we attract individuals to our community, that we look at pockets of improvement in wages. We did our, sliding scale for increasing the minimum wage over a period up to $15 an hour. But also, how do we get the companies here? Right. I was just like you, and I live in Middletown, and we just turned dirt on the Wuxi project. That's a big pharmaceutical company that's coming. That's a great opportunity. But also, not only should we be investing to keep big companies coming and staying in Delaware, but the hub of our state's economy is small business. Right. And so I've been extremely committed over the years in the House, Senate, and now as your lieutenant governor, to really work to ensure that small business has access to affordable health care for their employees, that they have access to tax credit, if they happen to be a minority or a business, that they get the resources and the links they need. All of that fits into why we came together today, which was a mental health, behavioral health issue, right? Around opioids. And so whether it's a big business, small business, we want folks coming to our state because they see we have a model in behavioral health. They see that we have good schools, and they recognize also our incredible limited liability corporations. And that's a whole nother interview too.
Right.
to
but
talk
it's a
about
great incentive
finance
to get
and
people
LLC.
in here. Right. I mean, we are a smaller state, but as you said, people enjoy us because we're effective, right?
Absolutely.
There's benefits to not having a large population. You can do a lot of things programmatically and see the results right away.
Yep.
And we thank you for being at the top of this and ensuring that Delawareans stay on the agenda, ensuring that things happen in Delaware that need to happen in Delaware, and ensuring the health, mental health, and safety for all Delawareans. Thank you so very much.
Thank you. Thank you so much for having me today.
And again, thank you for tuning into The Agenda. We look forward to seeing you next week right here on The Agenda.